Well, Phil, first of all, thanks for joining us. I know it's a pretty busy time for you with what's going on, but first of all, let's take a quick summary of the independent review on NHS Hospital Food Review. It's now available. It makes for interesting reading. Perhaps we could highlight a few of the recommendations. And firstly, one that I think is pretty important is the catering staff support, attracting and motivating chefs in healthcare. It's extremely challenging. What are the recommendations to improve in that area?
It's a really good point, Paul, because I think whether you're in hospitality or in any type of catering sector, it's a people business. And we recognise that chefs in healthcare and in social care are probably not often paid what they should be paid. They're not often given the credit for what they do. Often food is a complicated business with patients coming in through hospitals. It's always unplanned, and therefore we need to ensure that we're giving the right food to patients, so that they're either, first of all, linking into the malnutrition, but also around building them up so it's a real recovery for them, and that needs to be managed. And what we're recognising is that, first of all, staff need to be paid enough money. They also need to have the right skills. So we're looking at what is the training that currently chefs have in healthcare? How can we take them forward in speciality topics like nutrition and diet, but also in things like dysphagia? And one big thing is around food safety. And we want all of our leaders, when it comes to chefs, to actually have that ability to be able to manage HACCP and food safety systems. So they need to be paid enough, they need to be qualified, and they need to be capable and confident in the roles that they have.
And one of the things that I actually saw in there as well was that they need to be recognised for the work that they do. So basically, you're thinking about maybe having an award ceremony just for chefs and for catering personnel.
Yeah, I think a couple of things on that. We already run a salon culinaire, which is generally through the Hospital Catering Association. But what we would like to reflect is something similar to what the schools catering do, and that is have regional competitions for chefs and then have a national final. So we actually do celebrate what people are achieving. We're not very good, I don't know if it's a British thing, but we're not often very good about shouting about what we do well. And we want to put chefs on a platform where they can show their skills, but they can also talk about what they do, what are their biggest challenges, and how can other kitchens, hospitals and chefs actually learn from those that do it well. So yeah, we would like, first of all, to really have a much more enhanced chef stroke team of the year competition, and we would like many more chefs to actually enter into award ceremonies, so we have that opportunity to recognise those skills.
One of the things you mentioned just then was food safety, and of course that is vitally important because, of course, those in hospital are the most vulnerable, and the food helps aid recovery. So food safety is vitally important.
Yeah, it is, and of course, food safety is the bread and butter really for chefs and catering managers. What we have understood is that food safety often gets left at the door of the catering department, but we're very aware, particularly with something like listeria, where if it can be in sandwiches or in ready-to-eat products, it can end up getting up to ward level or in staff areas where those areas can be very warm, and they can basically have all of those ingredients that attract bacteria. So we need ward level, we need our leaders outside of catering as well as catering to have enough knowledge to know that food needs to be safely managed all the way through the system.
In terms of that, then you've got to be looking at facilities, because the report suggests that it's imperative that current facilities are preparing, cooking, serving food, they receive suitable funding. At a time when the NHS is sort of prioritising other things, is that feasible?
I think so. We're doing a couple of programmes at the moment where we're looking at the way, what are people funded? How do they spend that funding? And what support do they need to spend much more prudently and wisely? I personally know that there are some trusts that have had their funding cut. They're actually asked to work savings plans up when really they're not in a position to do so. But there are also many trusts that have significant funding. So we need to be consistent about how much should we need to actually have a purposeful budget for each patient. How can we look at the systems that we've got currently in place, and how can we measure system against system? And that's really hard. When you look at something like the ERIC data, which is out for the public to see, you know, they will think, well, why has one hospital got £5.50 a day and another one got £23 a day? To the public, that makes no sense at all. So we need to break down those costs so the public can actually see a transparency of the way we manage our food costs.
And in terms of enforcing standards within healthcare and the food, very little evidence to prove that food and drink standards are being monitored closely enough, something that was highlighted in the report. What are the recommendations to make that better?
One of our strongest links is into the new food standards that are due to come out between December and January time. And obviously one of the recommendations for the review is that the new food standards need to be legislation. They need to have that strong arm, which actually makes sure that it's not a nice no, it's not a best in line, best practice. It is something that we expect people to do, and they will be held to account on those standards. So that is something that we're working through right now. So those standards will again focus on the typical things that we've talked about before, around nutrition, around safety, around the quality of food. But the review will actually force those standards through as an NHS business point of view, to ensure that when we travel around the country, you know, when times obviously change, we're able to say to people, why are you doing it that way when you know this is what's right? And try to understand that it's okay to have a variance, but there needs to be a consistent stream that runs all the way through the way we manage our catering.
And in terms of that, sustainability and waste, I was reading that obviously there is a lot of waste, some millions of pounds wasted in food, and there's an inconsistency with purchasing high quality products, understanding the role of sustainability, and of course managing food waste as well. Recommendations regarding that, Phil?
Yeah, and sometimes, you know, food waste gets a difficult label because often through something like ERIC, you can actually see the tonnage of food waste that actually is thrown away. But we have to remember sometimes that may be preparation waste, you know, so there can be different elements of it. What we need to happen is actually measuring waste that is left on the trolley, that is left on the plate. And that for me is the actual waste. You know, food that we should be putting in front of a patient should be the right portion size. It should compile of the right nutrition. It should be the meal that patient has chosen as close to the point of service as possible. And we need to really compress that percentage of waste. We understand there will always be, you know, 3, 4, 5% of food waste around because it is impossible to get it down to naught. But we need a consistent template that measures waste. So no matter what service you had, you know what the expectations are and how we can help those trusts actually squeeze that waste level down to a suitable level.
This is going to be a difficult one for you. The review has only just been published. Going forward, what is the plan from here on in?
So first of all, we're looking at bringing together a small expert group, and it will be very small because there are so many associations and agencies out there that we want to link to. You know, for example, the Royal College of Speech and Language and Therapists, the BDA, Hospital Catering Association, Food Standards Agency, Public Health England. There are a dozen to 15 that we want to work closely with. So we'll have a small, tight-knit group that will actually look at the actions that need to happen and then link with the different groups to ensure that the drive can be at a suitable pace. I believe there are some quick wins that we can do over the next 2 or 3 months. We can get the expert group up and running. Hopefully in November, we'll learn about the spending review and how much capital we will have, and that will help us in our infrastructure planning. How do we replace equipment and buildings? How do we improve our ward facilities and our catering facilities 24/7 for staff to, to improve their health and well-being? So there's a long list of things we want to do, and we want to put it into a time plan. But people want to see action, and it's great to have a review that I think is purposeful. But people want to see, well, what's happening? Weeks and months afterwards, they want to be able to tick things off to see that we're moving at the right pace, and that the support we've had from government is actually happening.
The recommended changes, Phil, mainly apply to the government, NHS England, NHS Improvement, but trusts have got their part to play as well, haven't they?
Yeah, they have, and we often talk about the whole hospital approach. The hospitals, and we went to over 30 during the review period. The best hospitals on a catering service point of view are those that have this whole hospital approach, where the chief exec, the chief nurse firmly believe that food and drink, nutrition and hydration is a core value, not just for our patients, but for our staff, for our colleagues. So if they firmly believe that food is spoken about at the top table, then I really believe that change will happen quite quickly in those areas. What we need to do is support those trusts where food isn't talked about at the top table. How can we help them? How can we go and visit that chief exec and that board to say, well, we need to challenge you and say, well, why would you not want to be serving great food and having an availability of food and drink for our colleagues around the clock? Whether you work at 2 o'clock in the afternoon or at 2 o'clock at night, you should have good food and drink available.
And finally, to finish off then, Phil, we must stress that most hospitals do a good job when it comes to looking after their patients. The food is generally good. It does need improvement, but we've got to stress that most hospitals are good at what they do.
Absolutely. And for people that tell you that hospital catering is boring, please ignore them. Okay, we have got some fantastic innovators out there that have brought things onto the menu, whether or not that is a high-line product or it's a seasonal product, the way they make their food look presentable in a very, very difficult and challenging environment. Their relationships that they have with their dietitians and their nursing colleagues is really second to none. We're incredibly proud that the BDA and the HCA have given us on the review panel fantastic support to drive this home. We will make it work, and we will use those people who are exemplary as an open site. If people want to go and talk to them and see how they do things well, then hopefully we can spread that good news.
Phil, it's been fascinating, and we'll get an update from you maybe in a couple of months. But for now, thanks very much indeed.
Thanks, Paul. Good to talk to you.